Hey everyone out there, it's Roberto Miki again, and we've got another great question in our series of board and in-training review questions. And if you're a medical student, fellow, or resident looking to study for these exams, please check them out. Plug for the channel, hit like and subscribe and help out our channel so we can continue making these videos. So the question is, what is the most common carpal coalition? A. Scapholunate, B. Lunotriquetral, C. Scaphocapitate, D. Capitohamate, or E. Lunocapitate? Well, if you want to answer this question and you need a little time, please press pause at this point. The most common carpal coalition is the lunotriquetral coalition, and the highest incidence of this coalition is found in West Africa. And in Europe, amongst Caucasians, it is very uncommon, only accounting for 0.1% of the population, versus in some tribes, such as the Bantu, it could be up to 8% in Africa. The lunotriquetral coalition is subclassified into 4 Minar types. 1, a fibrocartilage coalition. Number 2, an incomplete osseous bridge with a distal notch. Number 3, a complete osseous fusion. And number 4, a complete osseous fusion with some other abnormality. So this is an AP view of a wrist, and you can clearly see a lunotriquetral coalition on the left side of the x-ray, and here it is circled in red. There is a lunotriquetral coalition there. There should be 2 bones and there's only 1. The x-ray to the left here is of a different person, and it clearly shows within the red circle that there are 2 bones, the lunate and the triquetrum. This x-ray is actually of a distal radius fracture, and the blue arrow shows where that fracture is. But nonetheless, the lunate and the triquetrum are separated by a small black space. The arrows in this slide depict exactly where that black line is. So to depict and to help you learn what the lunotriquetral coalition looks like, I'm going to number each of the bones in the wrist. Number 1 in both x-rays is the scaphoid. Number 2 is the lunate. Number 3 is the triquetrum. Number 4 is the pisiform. Number 5 is the trapezium under the thumb. Number 6 is the trapezoid. Number 7 is the capitate. And number 8 is the hamate. So you can clearly see on the x-ray on the right that the lunate and the triquetrum have a contiguous bone, and there's no space between the 2 of them. Number 2 and number 3 on the left side have a space between them that is a black line separating the 2 bones. The space depicted in the x-ray on the left is a normal space, while on the right x-ray that is not normal. So the answer to the question is B, lunotriquetral coalition. Well everyone, thank you for watching. This is the end of the video, and we'll see you at the next one.